Thank you for joining us. This is an exciting day for Orange County Fire Rescue as we launch a new initiative that we believe will save lives here in Central Florida. We'll begin today with Orange County Mayor Jerry L. Demmings for the official announcement for Orange County Fire Rescue Department.
Good morning to all of you. It is a great day here in Orange County with the announcement that we'll be making shortly. We do appreciate the partnership that we have in our county. We couldn't get the work done of taking care of the people and saving lives. As I see it, the fundamental reason that government exists is to keep the people safe. And so we are a county that supports and pays our public safety and first responders like they deserve to be paid. We couldn't do that without the support of our Board of County Commissioners. I have County Commissioner Myra Uribe, who is here with me today. Commissioner Uribe. I do acknowledge our fire chief today, Chief James Fitzgerald, and his entire team from the Orange County Fire Rescue Department. But we have wonderful community partners who work with us every day, and over the many decades of public service that I've been engaged in, certainly One Blood has been a great partner of ours. My wife and I have been blood donors for decades now, and we are blessed to have the Orlando Health in our community, one of the top hospitals anywhere, the only level 4 trauma center that we have. And so thank you to all of our docs in the white coats who are here, and Madam President, also from Orlando Health, for the partnership that we have. Orange County Fire Rescue is really proud to be one of the first departments in Central Florida to implement this new critical life-saving program, actually the first. So I think that deserves a round of applause this morning. Thank you, Chief Fitzgerald, for your leadership of being the first. We are committed to enhancing the emergency medical services we provide for our residents and visitors. This new program will significantly improve the outcomes for trauma patients. Our EMS paramedics are in the business of saving lives, and with this additional tool, they will be able to provide the best possible care to their patients, ultimately reducing fatalities. During my 38-year law enforcement career, for much of that time, I was a special teams commander and responded to numerous crises that involved life-saving measures, times when there were members of our community who were on the verge of dying. And as a result of the trauma, the significant injuries that they had encountered, sometimes blood was what was really needed to save those lives. There were times when I responded to an incident where our first responders were seriously injured, firefighters and law enforcement officers. Quite frankly, sometimes they died. And I know that perhaps, just perhaps, if some of them would have had the opportunity to have blood supplies administered right there in the field, just maybe some of them would have made it. I can tell you that I went to a lot of funerals over those years and saw the certainty of the need within our community. And so I know that for Orange County, this is going to save lives. There's no question about it. So my call to action to the residents of Orange County is that in order to have the blood needed for this life-saving measure, we have to have the blood. And we need people to give, to donate the blood supplies in order for this to become a reality and have the true effect, positive effect that it can have on our community. So you're going to hear from our doctors and our medical experts in just a few moments. about how that will work. Again, as the mayor of Orange County, I'm honored to live in a county that leans into providing the best quality of service to all of our residents. Thank you again to all of you for being here.
Thank you, Mayor. Next, I would like to invite Assistant Chief of EMS, Chief Scott Egan, to the podium.
Thank you to everyone for being here today. This truly is an exciting time for Orange County Fire Rescue. We are officially the first ground transport agency in Central Florida to provide pre-hospital whole blood transfusions for our patients. Of the 23,000 plus EMS agencies across the United States, there's only around 170 that have started this initiative to date. As EMS evolves, Orange County Fire Rescue continues to strive for innovative excellence in patient care and to provide the latest interventions for our patients. Our department is taking a giant step forward by providing blood transfusions in the field. Orange County Fire Rescue paramedics can now stabilize patients more effectively before transferring care to the hospital. This is cutting edge now, but this will be the standard of care tomorrow. Trauma is the leading cause of death for individuals under the age of 45, and the third leading cause of death overall. Hemorrhage, or blood loss, is the leading cause of death for those patients. Before this program, EMS field providers treating a patient who lost blood could only stop the bleeding, then provide saline water via an IV to help maintain the blood pressure for the patient, and get the patient to the hospital as quickly as possible so the hospital could provide the critical blood the patient needed. By providing blood to a patient before arriving to the hospital, we are greatly increasing the outcome of life expectancy. Seconds truly count. In 2023, Orange County Fire Rescue transported 917 trauma alert patients to area system trauma centers. These patients had multi-system injuries who required immediate intervention. Working with Orlando Health, we identified that 212 of those incidents required whole blood after arriving at the hospital. We analyzed the geographical location of those incidents, and beginning today, low titer O-positive whole blood will be carried on pre-selected captain supervisor units strategically located throughout the county with a focus on those areas. However, they will be able to intercept any of our 56 transport units countywide. If a patient is in need of blood, the captain unit will deploy to the scene or meet the transport unit while en route to the hospital to begin administering a blood transfusion, replacing the blood the patient has lost as soon as possible. We are proud to officially launch this program today through a collaborative partnership with OneBlood, Orlando Health, and the Office of the Medical Director. I'd like to personally thank everyone involved in each of these organizations for helping make this life-saving program possible. I'd also like to take a quick moment to thank my teammates who have worked countless hours to ensure the success of this program, especially Lieutenant Ryan Staples, who unfortunately could not be here today, and firefighter Brandon Ickes. These two individuals worked with others to champion this program, and they provided true dedication, passion, and commitment for its success. Thank you, Lieutenant Staples and firefighter Ickes. There were a lot of behind-the-scenes work performed in order to have this initiative possible. However, it also needed, and it has had, the support of county leadership. I would like to thank Fire Chief James Fitzgerald, who supported this program from the minute he heard about it. And I would also like to thank Mayor Jerry Demmings for enhancing public safety for Orange County by supporting this initiative. This program will save lives. Thank you.
Thank you, Chief Egan. Next, we will hear from Dr. Christian Zver, the Medical Director of the Orange County EMS System.
Good morning. I'd like to echo a little bit about what Chief Egan said. I mean, this has been a big effort from a lot of people that I think some recognition is deserved as well. I'd like to start with the mayor for his support. From the minute he heard about this program, he was right with it to bring this to the citizens of Orange County. For Chief Egan and his staff for their incredible amount of work and effort they've done to get this ready to go. Chief Fitzgerald obviously has a vision for his department, and without his leadership and vision, this wouldn't be possible. He has been behind this 100%, again, to bring the best possible care to the residents and visitors here in Orange County. And then in my office, Dr. Fitzpatrick, Dr. DeCesare, and Dr. Infanzon, who have been incredibly influential in the development and rollout of this process. This is really a historic day, but not just for Orange County. There's a small number of agencies that provide blood in the field to their patients. We're advancing the life-saving care provided to our residents and visitors. And this partnership, this advancement couldn't have happened without the partnership between Orange County Fire Rescue, the Office of the Medical Director, our partners in this at our Orlando Health's Orlando Regional Medical Center, our region's only level 1 trauma center, have been influential both in taking this to our adult patients, and then at Arnold Palmer Hospital for taking this to our pediatric patients. And then One Blood, who really is holding the key to this life-saving, precious resource. Historically, patients suffering from life-threatening bleeding or hemorrhagic shock, as we would call it, very limited options. Chief Egan went over those. We would try to stop the bleeding via direct pressure or via tourniquets or bandages, and then give them some fluids, and then get to the hospital and hope we get there fast enough that the trauma team, the dedicated trauma team, could make the difference in the patient's life. And blood administration was something that was done, but only at the hospital, not in the pre-hospital arena. But today, that's changed in Orange County. We have blood, whole blood, available in the field to our patients. Patients that are suffering from severe bleeding, patients that are bleeding to death. They need blood. And with the knowledge we've gained through the U.S. military, we also learned that the faster they get this blood, the better their chance of survival. And I said today, this has only been something done in hospitals, but our advances in science and medical technology has brought this to Orange County Fire Rescue, and we will be administering whole blood to our patients in the field before they can get to the trauma center on the scene. And I've mentioned whole blood a couple of times, and I make a distinction because there's different components of blood that can be given. Whole blood has all the components that you would find in your body. It's got red blood cells to deliver oxygen to your tissues. It has platelets. It has clotting factors to help stop the bleeding. And instead of giving water, which we did with saline, we're now going to give blood. People who are bleeding need blood, and that's what we're going to provide here today. So in order to do this, as Mayor Demmings said, we need donors. Programs like this can only succeed in a partnership with our community. So I would ask anyone who can donate to please consider. It can make a difference in all of our lives. So lastly, I mentioned the Orlando Health Trauma Team. I have to give a specific acknowledgement to Dr. Tracy Zito, who's the Trauma Medical Director at ORMC. She has been an incredible advocate for this, for her patients, and for trauma patients as whole, as well as Dr. Plumley with Arnold Palmer Hospital. And we are very fortunate to be able to work with them and have guidance on this matter. And I thank you all for your time.
Thank you, Dr. Zver. At this time, I'd like to invite Dr. Tracy Zito, Trauma Surgeon and Trauma Medical Director at Orlando Health RMC.
Good morning, everybody, and thank you for allowing me to speak on this really monumentous occasion. I would first just like to thank everybody. I know this sounds repetitive, but thank you to the mayor, thank you to Chief Egan, Chief Fitzgerald, to Dr. Zver, Dr. Fitzpatrick, and all the other folks that helped make this happen. You know, there's a lot of people that talk, but not a lot of people that walk, and we're making it happen. This is truly a game changer. Honestly, some of the most frustrating and heartbreaking moments in my career have been witnessing patients dying after injury when it was potentially preventable. Deaths from hemorrhage or massive bleeding have occurred too many times because we've had to use bags of saline or water to keep patients alive. And as Dr. Zver stated, and Chief Egan, we don't bleed water, we don't bleed saline, we bleed blood. And so what that bleeding human body needs to keep it alive is blood. Having blood, whole blood, available to these highly trained responders in the field allows patients that would otherwise have potentially died or have gotten to the hospital near death to get there in much better condition and have a much higher chance of survival. Truly life-saving. This is a milestone day here in Central Florida and a milestone day here in Orange County. We can now start what was traditionally hospital-only blood transfusions at the scene and on the way to the hospital. So the patient has a chance, dropping the number that would arrive, basically holding on by a thread when it counts most. You see, getting hemorrhaging patients to the hospital where we can surgically stop the bleeding is the goal. Now that first critical step can be done right at the scene and on the way to the hospital, and we will have fewer occasions to say they never had a chance. In the military, we call the U.S. Marine Corps warfighter the tip of the spear. That is exactly what came to mind as I was sitting to write this speech. When I think of this groundbreaking initiative, we literally will be piercing death and pulling patients back to life to get to the hospital trauma care, actually saving lives. Thank you very much for allowing Orlando Regional Medical Center to be part of this. It's something that those of us, and I'll speak for Dr. Plumley and Kelly Nierstedt, our CEO, it's something that we are incredibly passionate about and something that we've wanted to make happen. So thank you for making it happen.
Thank you, Dr. Zito. Lastly, I'd like to invite OneBlood's Senior VP of Corporate Communications and Public Relations, Susan Forbes, to the podium.
Good morning, and I too want to thank all the partners involved in this monumentous moment, to the county, to the mayor for your continued support of blood donation in our community. It means a lot and helps motivate people to want to be blood donors. And to Orlando Health, our partners in saving lives, we truly appreciate what you're doing with us here to make this happen. And to Orange County Fire Rescue, this is such a huge, huge moment for our community, and we're grateful to all of you for being our partners here at OneBlood. It is a massive team effort to save the life of a trauma patient, and key members of that team are type O blood donors. This is such an extraordinary program, and it will save lives, but it depends on people with type O blood to be donating blood on a regular basis. Type O blood holds a very unique power because it can help save anybody, regardless of the recipient's blood type. This is why, in a trauma situation, when a person's life is on the line, it is type O blood that the paramedics and the trauma team are reaching for to try and save that patient's life. It is truly life-saving. But you do not want to wait for a tragedy to become a blood donor, because it is too late. Blood has to be there in advance of it ever being needed. And that is the key, is making blood donation a habit. Donating each and every time you're eligible to ensure that ready supply for our community. Type O blood is in the highest demand by hospitals. And by making blood donation a habit, you are going to help ensure that supply is there. I often refer to blood donors as the first responders because they do their part days before the blood is needed, and as a result, it is there when patients are in need. There is absolutely no substitute for blood, so you don't want to take the blood supply for granted. In an instant, any one of us can find ourselves on the receiving end of a blood transfusion. Trauma situations happen in the blink of an eye. I assure you that the people who end up at Orlando Regional Medical Center on any given day did not plan on being there. They did not plan on becoming blood recipients. It happens. 1 in 3 of us will need a blood transfusion at some point in our life. One trauma patient can receive anywhere from 1 unit of blood up to over 100 units of blood. That's 100 blood donors to save one person. That is extraordinary. The fact that Orange County Rescue is now carrying type O blood on their response units shows you just how vital it is for these patients to begin receiving blood immediately. 1 in 3 of us will need blood at some point in our life. It's the person who's donating today that will help save your life tomorrow. Do not take the blood supply for granted. The call to action to the community is, if you are able to donate blood, we urge you to do so and to make it a habit. It is so, so important in our community. It is saving people's lives right now as we are standing here. If you have type O blood, please donate blood. You are needed today, you are needed tomorrow, you are needed on a regular basis to help save the lives of trauma patients. There is no greater gift than to give somebody their life back, and that is exactly what blood donors do. The power to save someone's life is literally running through your veins, so please share that power. The big red bus is everywhere. It's hard to miss it. You know what goes on in there. People are donating blood, so please hop on that big red bus and donate blood. We have 250 of them out in force on any given day, over 90 donor centers throughout our service area. The opportunity is there. It is a challenge to ensure a ready blood supply on any given day when less than 5% of the population is donating blood, when upwards of 60% can but don't. Please donate blood. I do want to take one moment to be able to explain, I know the doctor touched on what is whole blood, but I do want you to understand how this is collected at One Blood so you understand what is happening with the donors. When people get on the big red bus to donate blood, they are donating whole blood. We are collecting all the components of their blood at one time. And when they leave, in that bag is all the components of their blood: red blood cells, platelets, plasma, and white cells. Typically, those donations come back to One Blood and go in our biologics lab, and the team back there will separate that whole blood donation into the different components that were donated. So there'll be red blood cells can go to one patient, platelets to another, plasma to a third. This is why we say one blood donation can save up to 3 lives. In this situation, in providing whole blood on the rescue units, we are not doing that process of separating it. And the whole donation, the whole blood, is what is being provided in this instance. Testing is all the same. The process is the same to ensure that it's safe, but it's not being separated into the different components. It's the whole donation that will be going for this program. So that's it. All right, thank you very much.
Thank you, Susan. We appreciate all of our partners from the Office of the Medical Director, Orlando Health, and One Blood for being with us today for this announcement. If there's anyone you'd like a one-on-one with, there will be an opportunity once this press conference concludes. And at this time, we'll transition to my right, where there'll be a visual demonstration of the whole blood equipment. Thank you all again.